you may have heard some of the evidence that suggests there was uncertainty about the route of transmission. Do you think it would have helped CVF people if the communications had said, we don't know yet what the route of transmission is? Would that have been important to CVF's members?
Yeah, absolutely. I think any information that you can give people, though we were scared and frightened, we were, there's many capable people in society, as we know, and many capable people who have underlying conditions, and they would be really ready to understand that information, to empower themselves to be able to reduce their own risk. And indeed, that's what CVF has tried to do. That's what we've been doing, is really filling that gap from August 2020, trying to inform people about what masks can be worn, whether it's droplet or airborne, to be honest. What other things you can do to reduce your spread, ventilation, being outside, things like that.
I ask you, please, though, about CVF members' experience when they had to attend healthcare settings. And I think in particular, we've already heard some evidence about use of masks in hospital, and indeed CVF members attending hospital wearing masks and being asked to remove them. So can you help us, Dr. Finnis, with how CVF have found it when they've had to go to appointments in hospitals, GPs and the like?
Yeah, so it's changed throughout the pandemic. So initially, obviously, it was mainly remote, and generally speaking, our membership actually seems to like remote, generally. Although we also recognise it's not right for everyone and there should be a choice. And that, of course, it shouldn't be a choice of remote because healthcare isn't safe. That's what we would say, that it should be a real choice. Other things that happened was that some of our members went to hospitals and were wearing a mask like I'm wearing today, a good quality mask, well fitted, and they were asked to remove it and put on the blue FRSM mask that we knew and clinically vulnerable family members knew was not as protective. That was very stressful, very worrying for them. I actually experienced it myself, and I spent quite a long time outside just with the reception staff, kind of advocating for myself that I needed to wear this mask. But it felt that I was better educated than the healthcare staff at that point. And ultimately, there was no real fix to it. I was asked to remove it.
Well, that's what I was going to. Who won, I suppose, is an elegant way of putting it. Do you think? How did the staff react, though, when they saw you coming in wearing a mask and saying, look, I need to wear it because I have these underlying health conditions?
Yeah, I mean...
They seem to know how they were supposed to...
during the main part of the emergency part of the pandemic, I think because more people were wearing masks, it was more accepted. But there has been a real kind of sea change, I would say, really from when face masks were removed from hospitals in summer of 2022 in England. And in fact, we've done some polls in CVF, which shows the problem. So just before the masks were removed, we did a poll in 2022, and it was with hundreds of people who were clinically vulnerable. And they were asked whether they had delayed or cancelled any appointments. And we were told that I think it was about just above 50% had done that. Move on to November, though, of that year. In 2022, and we asked the question again, the same question, to the same group, and they over 90% now were telling us that they were delaying or cancelling appointments or operations in hospital. And we repeated it again, actually, in November 23. We need to repeat it again this year. And again, it's over 90% delayed or cancelled appointments and operations. Now, this is because people are now really worried. There are no mitigations in hospitals. And moreover, people who go in wearing a mask, and we've had many, many reports now of people being sort of gaslit why they need to wear one, belittled, made fun of, harassed, dismissed. That's despite the if I may, the government guidance still. So if you go on gov.uk and you look for COVID-19 guidance today for people who are severely immunosuppressed or higher risk, it tells us several things, if I may.
In your poll, in June 2022, if I understand it correctly, 54% of the contributors to the survey said they delayed or cancelled healthcare appointments.
Yes.
It jumps in October of that year, if I understand it, to 91%. Now, do you know why there was the jump between June and October?
Yes, because it was a drop in of face masks from hospitals.
Right. And have your members told you that, or is that something that you surmise from the timings? Yes.
I mean, our pages now, even today, are full of people having trouble accessing hospitals. They are unsafe for people who are clinically vulnerable. And one of the problems why they're unsafe is because of the problems of face masks. Staff aren't wearing them, but neither are patients.
Pause there, please, Doctor, because there's a quote in your statement that I'd like to just put up on screen. It's INQ... And
more slowly, please.
I'm doing it now. I'm so sorry, my lady. It's my fault, Dr. Finnis. 409-574_55. Just one of the quotations that you've provided the inquiry with. Quote 47 there from a CVF member. I feel healthcare is no longer safe now that masking has been removed. I find every visit stressful. I spend a week before and after feeling very anxious and worried. I can't cancel appointments. I need my treatments. I still need facial surgery for my skin cancer. But I've delayed having a minor surgery to have my port removed. It seemed safer in 2020 because everyone was masked, there were more virtual appointments available, and the hospitals were much quieter. I just wanted to bring to life something that one of your members had said to support the findings of the CVF survey. I think, though, you were going on to say, Doctor, and it's my fault I interrupted you, that there was several things in the current guidance that you wanted to tell us about.
Yes.
Thank you for watching Health Bulletin. Don't forget to subscribe for more updates on global health and science.